name is Dr. Jillian Wong, and I'm an optometrist who regularly treats dry eyes with a technique called Meibomian gland expression. The Meibomian glands are the oil glands that are located in the eyelids. These glands are responsible for secreting oil onto the surface of the eye that keeps the tears from evaporating too quickly. Without these oils, the eye will dry out too quickly and become irritated. There are approximately 20 to 30 Meibomian glands on the lower lid and 40 to 50 on the upper lid. Meibomian gland dysfunction occurs when the oil secretion is not normal from the Meibomian glands, typically causing blockage and clogging of the glands. This means that less oil will reach the eye and the tears will evaporate too quickly. This is why MGD or Meibomian gland dysfunction is highly associated with dry eyes. There are also glands by the eyelashes called the glands of Zeiss and mole. People often get styes when they have dry eyes. Typically when people say stye, they actually mean hordeolum. There are two types of hordeolums. One is called the external hordeolum. This is typically when there is an infection of the glands of Zeiss or mole, so typically an infection by the eyelashes. Hordeolums are typically acute localized swellings of the eyelid that can be external or internal and is usually pyogenic and usually caused by staphylococcal infections. Typically, most styes are external hordeolum, though there can be internal hordeolum where the Meibomian glands become infected. The symptoms of hordeola are tenderness and swelling. Typically for treatment, your optometrist will recommend warm compresses and lid massage to hope that the hordeolum will spontaneously drain. Occasionally, oral antibiotics may need to be prescribed, so please check with your optometrist if you have a stye. Also, it's advised not to try and pop your stye if you think it's infected, as the bacteria could get pushed further back into the eyelid. I typically won't express any styes unless they've been on antibiotics or if I'm sure the bacteria is no longer infecting the gland. Last but not least, we'll go on to the chalazion. Chalazion are non-infectious Meibomian gland occlusions. Disorders that cause abnormally thick Meibomian gland secretion, such as Meibomian gland dysfunction or MGD or acne rosacea, increase the risk of chalazion happening. Since chalazion are not caused by infection, then they typically do not require oral antibiotics like hordeola sometimes do. Instead, we also recommend hot compresses and lid massage for chalazion and hordeolum. Typically, the hot compresses will be for approximately 10 minutes, as hot as you can stand, 3 to 4 times a day to hasten the resolution. Occasionally, if the chalazion does not resolve by itself, then we will have to refer to the lid surgeon for drainage or a corticosteroid injection. Finally, now that we've learned the terminology, we can go on to the video. So today we're watching a patient who had this white bump here. Actually, I didn't even realize that it was an external hordeolum. Basically, she said that bump had been there for a while, and I didn't expect it to pop because it was not budging after the heated eye mask and the forceps that we're using for the Meibomian gland expression. This patient did have dry eyes, so we did try doing the IPL a couple weeks later to treat the dryness. Actually, I had not expected that it would do anything to that white bump, although now that I realize that it was an external hordeolum, then IPL actually is commonly used to treat chalazion and hordeolum. And here it's popping. So there we can see the pus that was in that hordeolum. So it did take a few tries to try and clear it. So here we're squeezing and seeing what else is coming out. Previously, when I did see her after the heated eye mask, I did epilate some lashes to see if it would drain, although it didn't drain in between. But here it is definitely coming out of the top. Next, I'm going to use a golf spud. So this is kind of a sharp edge, just to kind of see if I can open the opening. Obviously, you can see that I'm clearing away some of the pus as well. So we're doing a few rounds of these scraping and squeezing. Occasionally in this video, you might see that the is kind of going out of the frame. That's typically because the patient is moving. Typically, after each squeeze, I will clean the paddle in between. Afterwards, the patient was immediately able to notice that the bump wasn't blocking her field of view anymore, and she was extremely happy that we were able to get rid of it. I had not promised her anything, but I'm glad that we were able to get rid of it. So it did take many squeezes, just it was so full of that pus material, and I wanted to be able to get out as much as I could. So I haven't seen her back for her follow-up yet for her second session of IPL, but I'll be excited to see what the stye looks like when I see her back. Finally, this will be the final squeeze, in which case we did get a couple more pops. So hopefully you stay to the end to watch that satisfying pop. Otherwise, thank you so much for watching. Please like and subscribe. I hope to see you at my next video.